Now, the way I practice medicine, called integrative medicine, is very much using nature. We keep saying, let's do it naturally, let's do it naturally, because nature has the answers for us. If we go to the root cause, rather than treating the symptoms the way allopathic medicine has been doing, if we treat the root cause, we are actually going to make real changes. We're not going to just cover over things like a Band-Aid. So my credo, and those who practice integrative medicine, is to treat as safely and as naturally as possible. Not to be invasive, not to do any harm. And there are many, many side effects, as we know from the usual medications. And in terms of working with patients, clients that I work with, it's really a partnership. And that's true for all of you who are any kind of therapist or healers. It's a partnership. It's not us doing it to them. It's we're participating together with the expert or the consultant, in this case myself, as the guide, as the one who's more educated and who's passing on the information and sharing it. And treating the whole person, mind, body, spirit, and all the different aspects that affect us, genetic, dietary, environmental, and lifestyle factors. We really need to address all of that in treating addiction, as well as treating all the other things that, as a psychiatrist, I am also treating depression, anxiety, and bipolar illness even. And then, of course, the emphasis is on prevention. Let's stop addiction before it starts. Okay? And, of course, how we prevent addiction is the same way as how we prevent relapse, which I will get into. And in terms of the basics of addiction, and many of you are so familiar with this that it seems a little redundant, but what I'm seeing is that each time we hear something, it installs in a little different way in our brain. So if you're saying, yeah, we already heard that, it's okay, because it's going to embed itself even better in your memory. I know I need to hear something about at least 10 times before it really, really lives there. So we've been familiar with the psychosocial aspects, therapy, 12-step programs. They're very important in terms of people using addictive substances. Some other issues. Is it a moral issue? Do people just need more willpower? And I think some of you at this point do know the answer to that. Certainly there are genetic factors and biochemical factors, all of them influencing one's propensity to become addicted. The question is, are we programmed for it? We heard Ken Blum speak about the reward deficiency syndrome, about the inborn deficiency in the number of dopamine or pleasure neurotransmitter receptors. So if somebody doesn't have enough receptors for dopamine, for receiving pleasure, what are they going to do? They're going to create whatever they can to make those dopamine, the ones that they do have, to make those receptors fire. And what does that? What's going to help make the dopamine receptors fire? Thrill-seeking behavior, stimulant drugs, alcohol, all kinds of things that get people into terrible trouble, and they're doing it out of survival. This is not a moral thing. It's not a bad thing. It's people are needing to feel good. They're needing to feel normal in many cases. And that's why they're turning to all of this pathological behavior, including substance abuse. So you may have this inborn error, but you know, it's not your fate. You actually can do something. We can do something to overcome it, to counteract it. This question also about the psychological issues behind addiction. And we know there certainly are psychological issues, and therapy certainly helps. On the other hand, look at some rats here. Rats were fed junk food, and they became addicted, as opposed to the same breed of rat, because you have to breed them specifically. The same breed of rat had a healthy diet and did not become addicted to alcohol. And these alcoholic rats, when they were treated with amino acids, they lost their craving. They lost their addiction. So they didn't need a 12-step program. They didn't need to go into rehab. They just needed to get the right supplements. So it's using the animal model, and we are and we aren't animals. Certainly we have that, the physicality, but we're not exactly rats, and we really do have psychosocial influences. But just look how really important it was for those rats just to be given the right diet to stop their cravings. I think that's pretty significant. So when we're doing, here is a list of recovery basics, right? First of all, psychological and spiritual transformation. Get in touch with feelings, history, clean up old stuff, old traumas, deal with PTSD, have a spiritual practice. Detox, removing the drug residues. You don't want to put junk on top of junk, and that's what happens when you use meds. You're putting drugs on top of drugs. We really want to clean those out. You want to reestablish normal brain chemistry. So just like those rats, no more cravings. And then once the person starts to have normal mood and cognition, they can think clearly, they feel good, they wake up in the morning, they feel good, they have energy, they're not going to have the cravings. They just won't be there. And people are just so surprised when that happens. Like, oh my God, I haven't been drinking. I haven't been feeling like drinking. And they almost forget. Have you had experience with that, treating people? Who's had that experience? Where the individual kind of is just not, it's so not in their consciousness that they forget that they aren't doing it. These are people who don't have if somebody's in a drug lifestyle, it's different because they have the cues all the time. But people who are like, quote, in the Buddhist term, householders, regular people who have their little alcohol addiction or their little quiet addiction that doesn't, they're still living with a family and all that and have a job. Those people, they really will just kind of like, oh yeah, that 6-pack of beer, well, it's been in my fridge for 2 weeks. Anyway, so that is what happens. And by the way, besides what we take in, the amino acids and nutrients in our diet, affecting the neurotransmitters, positive thinking can also affect neurotransmitters. We actually, if we use our resources, our inner resources, like positive thinking, or using exercise even, we can raise our own neurotransmitters because this whole pharmacy is in our brain. Even when we're using cocaine, caffeine, sugar, whatever it is, what we're really doing is affecting our neurotransmitters. We're releasing neurotransmitters. We're affecting our receptors. So the truth is, it's all going on in our own brain anyway. And give the brain a little help, and it'll go a long way toward making things better, making things normal. Now, the brain is an organ, and we have to remember this. It's so interesting because psychology came to being, and everything became, it's all psychological. It's all in your mind. Well, it's also in your brain, and the brain is an organ. And even though it's a little 3-pound organ made mostly of fat, it uses 20% of the blood sugar. 20% of the glucose, oxygen, and nutrients go to this brain. It's very, very metabolically active. And those of you who have brains, your brain's going all the time. And all these things are going on. All these other physiological activities are going on all the time. Your hormones, your neurotransmitters, all of that. We don't even have to think about it. And then there's all the thoughts that we have that we are aware of. So just be aware of what a beehive this brain is. And the communication among the neurons or the brain cells are the neurotransmitters. And in order to have neurotransmitters, we need precursors. We need nutrients. We need to make them out of something. And did I skip a slide? Yeah. Okay. So to begin with, I want to just review, and I think this will be a review, what we need in order to make our brain work properly, to make brain cells and to make neurotransmitters. And again, all of these are in your syllabus. First of all, to quote R.J. Crumb. Anybody remember R.J. Crumb from the 70s? Really funny cartoons. This was in the hippy-dippy days of old. I date myself. Okay. It was really before I was born, but it's okay. To start with, we need the right carbs. Not sugar, not white flour, complex carbs. The whole grains, vegetables. We need carbohydrates as brain fuel because it breaks down to glucose, and glucose is it. Glucose is what the brain burns for energy. Then we need protein. We need protein to break down into the amino acids, and the amino acids become neurotransmitters. Then we need vitamins and minerals, which are cofactors. They help the chemistry work. They act as catalysts in the chemical process in changing our food, our amino acids, into neurotransmitters. It's really quite amazing. We don't have to know anything about this, and it just happens. Isn't that amazing? I mean, it really amazes me when I think of the human body. I loved medical school because it was like really awesome to think of what goes on, and we don't have to do anything about it. It just happens. Antioxidants. We need to make sure we have plenty of antioxidants because we're so exposed to toxins, and then people who are addicted are particularly needing antioxidants because they've created a lot of what are called free radicals. The toxic substances, the medications, the drugs, whatever they're taking, have caused a lot of free radicals, and we need the antioxidants. We need to give them antioxidants to help quench them, to neutralize them. Another very important another part of the diet, an aspect of the diet, are eating good fats rather than bad fats. Bad fats are the saturated fats aren't so bad. The trans fats are really bad. And they go to the brain, and your brain is made of mostly fat. And so if you're eating French fries, that's the kind of fat, the trans fat, is going to go into your brain cells, and they're going to be not very healthy cells. And in those cells, in the cell membrane particularly, is where we make the neurotransmitters. So if you're eating bad fats and you don't have enough of the good fats, you're not going to be able to make the really good neurotransmitters and make them efficiently and effectively and have a really good flexible brain cell. And plenty of water. Do you know a lot of people who have Alzheimer's type symptoms, forgetfulness and all of that, are actually dehydrated. And as we get older, our cells don't hold water as well. So it's very important to pay attention to hydration, particularly in the elderly. Do you have a question there?
So you're saying that drugs increase the load of
free radicals
over and above a regular diet?
Yes. Yeah, anything we take that's toxic, that's what toxic generally means, that we're poisoning our cells, and the cells then need to have help in reestablishing their integrity. Yeah, Josh?
6 oils that are really important to have?
I'll get to that, yeah. I'm going to hold questions because I have a feeling that most of them will be answered in the course of, and I'm hoping to leave time for questions, okay? I always say that, and sometimes I go over, but I will try. Or I'll talk faster. Now, it's very interesting that with diet, very often just changing a diet can do a great deal in stopping cravings, certainly for carbs. And then you add in the supplements, and you can really, really stop the cravings for all these heavy-duty drugs, cocaine, heroin, benzos, sugar and caffeine. I didn't really put them in order of badness. I put sugar and caffeine at the end. But these are all things that have cravings, that are not healthy for us, and can actually be mitigated by taking the right supplements. And we also want to make sure that it's not just supplements. The diet is a very, very important substrate. You've got to have the right foods first. Then the supplements are just that. They are supplementing the food. And then, of course, this big caveat, do not substitute sugar, caffeine, and tobacco for the drug of choice, as many 12-step meetings have. You know, the cookies and the cakes and the cigarettes and the coffee, you know the drill. So that is not a good idea because you're simply perpetuating the problem. It's not as severe. They're not using illegal drugs. They're not using heavy-duty drugs. But in a sense, it's really perpetuating the same problem, and you never get over the cravings. First of all, we need to deal with blood sugar, and that's what I mentioned earlier, how the brain works on glucose, and our whole body works on glucose. It energizes our cells, and we like sugar. Sugar makes us feel good. So and this is what happens. For example, eat a Twinkie, okay? You eat a Twinkie, what happens? Your blood sugar goes up. And then insulin comes along. This is a message goes to the pancreas that says secrete insulin because there's too much blood sugar. So actually I have a really nice kind of diagram here in the next slide, which I'll get to. So the insulin sweeps the glucose into the cell, and there's a drop in blood sugar, and an alarm goes out. Oh no, the blood sugar's too low, because it doesn't always balance exactly right, especially people who are really on this roller coaster of ups and downs of sugar. And the sugar goes down, and then there's an adrenaline release, a danger release. Oh no, glucose is too low. This is dangerous. the brain isn't getting enough glucose. So this adrenaline release, which is the fight or flight response, and sugar is released as a result of that. So you get this rush of adrenaline, a rush of glucose, and it's kind of, it's an anxiety feeling, but it's also kind of an exciting feeling. And some people become addicted just to that adrenaline rush, and end up depleted, depressed, and burned out. And this is a diagram that shows how this works. Here you get a bunch of glucose. Can you see it? Pardon? Okay. You have high blood glucose here. See, you have high blood glucose. Insulin comes in, takes the glucose, and sweeps it into the cell. And suddenly, there's hypoglycemia. So the stress response occurs, and there's a release of cortisol, dopamine, adrenaline, noradrenaline, and that puts out some more sugar, and you're back in the cycle, and over and over and over and over again. The only way to break the cycle is to stop the massive sugar intake. And you become pretty toxic from too much sugar and too much insulin. And ultimately, you become insulin resistant. And this is a big epidemic now of what? Obesity, and what else? Diabetes, right? Metabolic syndrome. Metabolic syndrome is the precursor. It's just before you have diabetes. Anybody know what metabolic syndrome, what some of the symptoms are? I'm just curious. Yes? Apple shape, okay. Yep. Obesity, it's called truncal obesity. You get fat right around your stomach, so you get kind of round and apple-looking. High blood pressure, high cholesterol, and yeah, high triglycerides, high cholesterol, particularly the LDL cholesterol, high blood pressure, and high blood sugar. And you're on your way to becoming diabetic. And being diabetic is no picnic. So very important to start with the kids, because what used to be called adult onset diabetes is now hitting kids at younger and younger ages. Pretty serious. So that's the sugar blues. Now let's get to the neurotransmitters. So we talked about the basic diet and the carbs and the glucose and the protein and fats. Now we're talking about neurotransmitters. When you eat the protein, it turns into amino acids, broken down to amino acids, and that they are broken down into these various neurotransmitters. And by the way, if you want more details on any of this, not only are they in your syllabus, but they're in Natural Highs, which is available in the bookstore, because I can't really cover it in the kind of detail that you may be wanting to hear it. So serotonin, as we know, is the happy neurotransmitter. It's for mood, for sleep. When the tryptophan scare happened in the 80s and people were not able to get it, many depressed people had been counting on it. They'd really been doing very well. When the tryptophan was taken off the market, these people really suffered. There were quite a few, believe it or not, quite a few suicides. Because these are people who either didn't want to be on meds, couldn't be on meds, whatever it was. They had their tryptophan taken away. They would be depressed. They'd have insomnia. And a number of them, and very, very sadly, committed suicide. And there was never any reason to take the tryptophan off the market. It happens that the tryptophan scare happened just at the time that the first SSRI, Prozac, came on the market. And I believe that there was a strong political sort of thing going on there. And we have now, fortunately, we are able to get tryptophan again, or 5-HTP, which turns into serotonin. You get the endorphins, which promote bliss and euphoria and pain control. Catecholamines, adrenaline and noradrenaline, and dopamine for what? Another form of feel-good neurotransmitter. Motivation, mood. You feel stimulated and you care about things. You want to do things. You get up in the morning and you feel really good. That's the catecholamines. GABA. We need to have GABA. We need to have something to control the catecholamines, because if the catecholamines just keep going up and up and up, you're just going to get so motivated, you're going to out-motivate yourself. You're just going to get too high. So GABA comes and modulates, moderates, and there's a wonderful check and balances that go on. It's like a very fine-tuned orchestra that goes on in our brains all the time. It's not just in our brains, because there's neurotransmitters made all over the body. 95% of the serotonin is made in the gut. Anybody know that? 95% of our serotonin is made in the gut. And the gut-brain connection is very important. When you say you have a gut feeling, a lot of our feelings do originate in our gut. So it's really a whole body issue. So next is acetylcholine, and that's the one that goes down with age. We start to forget people's names. We walk into a room and, oh wait, was I just coming in here for? Or has this happened to anybody here? Yeah, I must admit. Okay, so acetylcholine does go down with age. Fortunately, we have amino acids that we can take for all of these issues, so we're not doomed. But it is, it's certainly an increasing problem with the increasing number of baby boomers. So here we are. We have these neurotransmitters. We can make them. We can increase them artificially with addictive substances. So why not? I mean, why not drink? Why not use coke or meth or heroin when they feel good? Well, what comes along is first of all, down regulation. You keep doing this and the brain says, wait a minute, there's too much stimulation, there's too much going on, we're going to dampen it down. So it shuts down some of the neurotransmitters. So let's say you're a coke addict and you're using cocaine, and the receptors are getting more stimulation, which means more dopamine than they usually get, and some of the receptors are going to shut down because they're being overstimulated. Then you take away the cocaine, and the person has too few receptors, and those too few receptors aren't getting enough dopamine, and so the person starts to have withdrawal. So downregulation happens, and that causes withdrawal. So you don't want to have withdrawal, so you go seeking more addictive substance. And that's the vicious cycle of addiction. So you can't win. You can't fool Mother Nature. And then ultimately you develop tolerance and you keep needing more and more of the same substance to get that same good feeling. So you're always chasing your original high. So addiction is a no-win. And this is why it's a no-win on a physiological level. This kind of explains the physiology of it. And as a result, you just burn out. You're exhausted. And then you can't sleep. You're subject to impaired immune system. You get a lot of infections. Your hormones become imbalanced because all of this is a very, very fine-tuned system. Your hormones, your neurotransmitters, your blood sugar, it's all very, very connected. And if you come in and mess around with any one of these elements, all of the others will go out of balance. And you're going to have an out of balance, unhappy individual and possibly a dangerous individual. This is something I mentioned a little earlier, and that is that we actually can become addicted to stress. You know about stress junkies? They're always needing to have some excitement, something actually difficult. Drama queens, okay? It's that adrenaline. The adrenaline gives them a feeling of being alive. And when they don't have that adrenaline rush, they feel half dead. So they're always causing some kind of drama in their life because that makes them feel alive. They don't feel alive without it. So they're very smart, in a way. That's sort of the wisdom of the body. Because, I'm feeling terrible, but if I do this, I know I will get a rush. They don't know that it has to do with blood sugar and adrenaline and all that other stuff, but they know if they do that, this is what happens, and it becomes a style, and it becomes a personality style. And so the question is, well, is that a personality style, a histrionic personality, or is it a chemical imbalance? If this person handled their impaired blood sugar, their hypoglycemia, there's a possibility that they could then become much more normal in who they are and how they behave. And they probably need a little therapy, but it's much easier to do psychotherapy as those. How many of you are therapists? Okay. We know we can do such better therapy when a person is really present, when their whole brain is able to focus, right? They're there. I mean, you try doing, I've consulted to addiction treatment centers where people are not only coming off of their addictive substances, but they've now been put on medication, and they are not really there. They're kind of zombied out. And the fact that they're in therapy, in group therapy, 12-step programs, is almost irrelevant because they ain't there. So this is another really big issue about using meds to detox from drugs. And that's a whole other issue that I'm not going talk about as much right now, but just be aware that what we're really looking for is clarity of people's brains. We want them to clear up, to not have cravings, and to restore their brain power, not to snow them anymore and make them into like these kind of walking dead. I mean, yeah, it's better that they're not using, but they're not there. Okay, we know the downsides of the stimulants. There are some actual things that happen. You can get rapid and irregular heartbeats. You can get arrhythmias. You can get high blood pressure. You can get gastrointestinal problems. So all these stimulants, we know that they're not good for you in that they're addictive, but they actually can have some pretty bad effects on the overall, on your overall physiology, and can be actually deadly. Again, alcohol, serious brain damage and serious liver damage. I've seen people bleed to death from varices caused by cirrhosis of the liver from chronic alcoholism when I was working at County Hospital many years ago. And of course, there's vitamin depletion. It totally wipes out your B vitamins, for one thing. So very important in recovery that you repair and replete the brain and the liver in the process. And then what about meds? I've mentioned it a little bit. Well, the meds are really a Band-Aid approach. They're dealing with the symptoms. They're not really addressing the underlying problem, and it's replacing one drug with another. And let's get to the root cause. Let's get to where we really are going to make a real difference, really change the physiology and the biochemistry instead of just covering over symptoms, because we're never going to get anywhere that way, and we know that. You know, the revolving door of the addiction treatment centers. Kind of obvious, isn't it? And I'm just going to give a little description here of how drugs work versus how nutrients work. Drugs being the drugs of prescriptions, medications. They short-circuit the brain chemistry. They're not working with the brain chemistry. They're masking things. They fool the brain. This is really interesting. They're not really giving you anything. They're not giving you more serotonin. They're not giving you the raw materials to make serotonin. They're fooling the brain into thinking that there are more serotonin molecules than there really are, or more dopamine molecules than there really are. Those are the SSRIs or the NARIs, but they are not really making any true substantive difference. And you take away the medication, and you're actually worse off than you were, because these drugs deplete neurotransmitters. Not only are they not creating new neurotransmitters, they're actually depleting you. So what we really need, of course, are the nutrients that are going to make the neurotransmitters. So all we're doing with the meds, or with anything that's addictive, sugar, caffeine, alcohol, it's just a little temporary fix, and it's never going to address the real problem. And the psychotropic meds have some real dangers. One of them, the antidepressants, are fraught with side effects. First of all, they're not that effective. I mean, in terms of percent of people who get a good result from antidepressants, less than half report a positive result, and most people have some pretty bad side effects, and a lot of people would rather quit the drug altogether because the side effects are so difficult. Nausea, GI upset, headache, suicidality, with the SSRIs, serious loss of libido. So here you may be less depressed, but you have no libido. And that drugged feeling. A lot of people on antidepressants and SSRIs say, I just have this chemical feeling. I'm not happy, I'm not sad, I'm just sort of blah. You know, they can't get really excited about anything because they don't really have the neurotransmitters to function. So it's being in like in a mental straitjacket. So it doesn't really feel good. It's just making them not as deeply depressed as they were. Then we get to the neuroleptics, and what we're seeing with them are all kinds of really bad problems. I've only listed a few of them here. First of all, tardive dyskinesia, irreversible movement disorder. Tardive dyskinesia, where people have these strange movements and tics as a result of damage done by these drugs. Also metabolic syndrome or diabetes. Metabolic syndrome, which is turning into diabetes, serious, serious problem, and it's being addressed actually in the medical journals, but not really well enough. I think they need to address the whole root issue of, well, why are we giving these drugs and are there better ways to go? I think that's really the question they should be asking. And the anti-anxiety drugs are just terrible. They increased by over 35% in the last year, terribly addictive. And you know, if you read the PDR, they're only recommended for 2 or 3 weeks max. And people are on them for years and years. The doctors just keep refilling the prescriptions, and what happens is the tolerance develops, and these poor people can't get off it. They're on a merry-go-round. They cannot get off the anti-anxiety drugs, the benzos, because of terrible withdrawal. So they stay on them, and they have tolerance, which means it's not really working, but if they went off them, they'd be really in trouble. They would just be so terribly anxious, they could even have seizures. So they tend to just stay on for years. And part of the withdrawal process when I'm treating people, obviously, is to add in the amino acids and actually add in some herbs as well, some calming herbs as well as amino acids. And that's very, very helpful in helping people get off the benzos. They're also, of course, dangerous because people mix them with alcohol, and that can be certainly fatal. Many accidents are caused by people on benzos, even if they've taken it the night before for sleep. The next day, most accidents, there was an article I read that they looked at the stats of accidents, and the majority of accidents were actually caused by people that had been on benzos in the past 24 hours. It's very serious, yeah? Sleep driving. Oh, that's a whole other issue, right, yeah. Definitely. And you can get some very strange, what are called parasomnias on some of these sleeping pills, where people get up, they drive, they do all kinds of things, and they're unconscious. It's like a dissociative reaction. They're not really awake, and they're not really asleep, and they're under the influence. It's very dangerous. Here's a cartoon. Never take a pill that has more side effects than you have symptoms. Never take a pill that has more side effects than you have symptoms. Good advice. Good advice. Here's some of the, I'm not sure if you can you see this well enough, this slide? It just shows the conversion on one side of tryptophan, which is an amino acid, breaks down into 5-HTP, which breaks down to serotonin, and ultimately to melatonin. And on the other side, we have phenylalanine, which is a catecholamine, breaking down to tyrosine, which then produces the neurotransmitters dopamine, noradrenaline, and adrenaline. And these are aided by B vitamin C, zinc, magnesium. I didn't put copper. There are a number of other vitamins and minerals here that I didn't add, but there are a whole lot of cofactors required for those conversions to occur. We also need the omega-3 fats to help make the brain cells. So these are all the nutritional components that we need to have healthy brain cells and healthy mood and the ability to think and feel appropriately. And here are the nutrient solutions. I'm going to go through this pretty quickly. It's been covered elsewhere. It's in the syllabus. And I'll just run through them. First of all, the catecholamines, phenylalanine and tyrosine. Okay, phenylalanine, tyrosine, catecholamines, they're precursors to dopamine, adrenaline, and noradrenaline, also a precursor to thyroxine, which is thyroid hormone. And I see a lot of low thyroid, which one of the treatments is you can give more tyrosine and also iodine. There's often iodine deficiency involved. And in my book, 8 Weeks to Vibrant Health, I actually cover this in more detail, issues of thyroid and adrenal imbalance. The other thing, by the way, I'm just an aside, and that is often low thyroid is due to low adrenal situation. Because if you have adrenal burnout, your body is actually turns down the thermostat, turns down your thyroid a little, so you wouldn't be over-stimulating or over-taxing a body that is kind of burned out. So before treating somebody with thyroid hormone, it's important to address the adrenals. And I'll talk a little more about that in a bit, about how to treat the adrenals. The catecholamines are going to enhance your mood and your energy and your motivation. You're going to feel better. By the way, D-L-phenylalanine produces phenethylamine, or PEA, which is found in chocolate, which may be why chocolate is so yummy. You know, women, particularly women, primarily or often premenstrual women, they really feel better when they have a little chocolate, because maybe because of the PEA, maybe because of the magnesium. Hard to tell, but seems to work. And it enhances endorphins. The endorphins are really feel good, the really lovely high feeling endorphins that we make as a natural pain reliever, natural euphoriant. Caution with phenylalanine and tyrosine. Hypertension, although that's really rare, and if you have phenylketonuria, obviously it's contraindicated. Dosage 500 to 1,000 milligrams on an empty stomach, first thing in the morning, right away to get you moving, and then a total of 1 to 3 times daily, and people can just titrate based on what works. And they just report back to the clinician. Like in my case, I will have people report back to me, and we adjust the dosage pretty regularly. And then practicing this kind of medicine is a lot more difficult than just writing a prescription, because I find I have to be really in touch with people. They have to report in. I have to see how they're doing. We need to adjust dosages and adjust actually what they're on. So it's more labor intensive, but ultimately a lot more rewarding. Then the serotonin-producing aminos, L-tryptophan and 5-hydroxytryptophan, produce serotonin, which are for relaxation. They make you feel good. They're natural antidepressants. They help you sleep really well and really deeply. A lot of people who say, well, I don't feel like I sleep very well, or they sleep for a while and wake up, they're generally low in serotonin. Once they're given one of these precursors, either the tryptophan or the 5-hydroxy, actually develop a much healthier sleep and wake pattern. And they're more emotionally stable as a result as well. By the way, try being sleep deprived for a while. You'll be very cranky and very dysfunctional. So often what you may find out with your patients is that what's really going on is that they're sleep deprived. And once they get enough sleep, they're not as nutty. You know, they can think more clearly, make more rational decisions, feel better, less anxiety, less irritability. And by the way, L-tryptophan, not 5-HTP, but L-tryptophan does need some carb to get into the brain. So if you're taking tryptophan, take it with a little bit of fruit juice, and that's enough carb to help it get into the brain. And the dosage of L-tryptophan is 500 to 1,500 twice daily, and a 5-HTP is anywhere from 50 to 150 once or twice daily, or all at bedtime. And by the way, these are not in stone, these dosages. I mean, I've gone higher with some people. Occasionally I have to go lower. So these are really just, they're guidelines. So they are not absolutely in stone. Moving right along, I mentioned earlier GABA is the calming neurotransmitter. It's the peacemaker, the regulator. It keeps us from getting too high or too anything. It's the nice balance. And it helps with sleep, with relaxation. I've given it to people with migraines, with alcohol cravings. Very, very important, both neurotransmitter and amino acid. It acts as both. At very high doses, it can cause nausea and vomiting. I've seen it cause nausea actually at some lower doses in very sensitive people. I give it anywhere from 500 to 1,000 milligrams twice daily, best between meals. Glutamine, I love it. It's fuel for the brain cells. It acts like glucose. It helps to build and balance neurotransmitters. It's great for addiction, great for hypoglycemia because it stabilizes blood sugar, and actually it helps promote memory. It's also very good for the gut lining. A lot of people, particularly heavy drinkers, have very messed up gut linings, and they're not absorbing their food properly. So what you want to do is give them a lot of glutamine. It's going to help stabilize their blood sugar, stop the alcohol cravings, and added bonus, heal their gut wall. So all in one here. Occasionally, headaches with high doses. You know, you can get anything with anything. And anytime I hear a side effect, I take it very seriously. And I know people report back to me that they've been to their doctors. They say they had a side effect to a drug. The doctor just gives them a higher dose or adds in another drug to counter the side effect. Well, I think we have to be very listening, very good communicators with our patients. And if they complain about a side effect, take it seriously. Listen to them because they know their bodies, and what we're teaching them is learn how your body works. Attend to it. And we'll role model that with them because we listen to what they're saying about what they're feeling. And it could be that they didn't have that role modeling earlier in life for the most part. Of anyone really, really listening and paying attention to them and to their bodies. Taurine. I really like taurine. It's nice. It's calming. I've used it for seizure disorders, for bipolar disorder. Very often, I do amino acid testing, so very often people are low in it, people who are addicts and coming off of whatever. And restoring the taurine is very good in terms of calming down the brain cells, calms down the electrical activity or the irritability of the brain cells. And no cautions that I have found, and use somewhere between 500 and 1,000 twice daily, 500 to 1,000 milligrams, but again, that's variable. Theanine, very nice amino acid. It's one of the ingredients in my Calm product. It's found naturally in green tea, and it's a calming neurotransmitter. I've had people say, oh, it feels like I drink, only without the hangover. So you know it's good if they say that. And it actually enhances alpha wave activity. Alpha waves are what happens when you meditate, when they put an electroencephalogram on your brain. When you're on meditators, you get an alpha state, and that's what L-theanine does. And it can be mixed nicely with GABA for a nice synergistic effect. Dose 100 to 200 milligrams, 2 to 3 times daily. Valerian, old standby, nature's Valium, very good herb for sleep. Reduces anxiety, insomnia, and muscle tension. It's also good for muscle spasms. I've used it as a muscle relaxant with patients, and also as an antihistamine. So you can use it for relaxation anywhere 50 to 100 milligrams 2 to 3 times daily. Again, titrate based on the person's sensitivity. And sleep, 150 to 300 milligrams approximately 45 minutes before bedtime. And no hangovers. And no tolerance, and no addiction the way we have with the benzodiazepines. Adaptogens, this is the adrenal. This is, I really want to emphasize this. We don't have, in Western medicine, we have nothing to treat the adrenals. However, what we do have in all the traditional cultures, Chinese medicine, Native American medicine, Indian or Ayurvedic medicine, we have adaptogens, which help to optimize adrenal function. They give more energy. And in a way that's not the way, say, the usual energizers, the caffeine and the other stimulants do. This gives you true energy, really supports the adrenals. And here are some of the adaptogens: ginseng, ashwagandha, rhodiola, ginkgo, valerian, reishi mushroom. So valerian has at least two functions here. Licorice root, which also helps your hormones, by the way, and milk thistle, which is an adaptogen, but it also is good for the liver. So again, you get at least double purpose out of a lot of these herbs. Those are the recommended dosages. I'm going quickly, and I'm not going to talk about them in detail, but they are in your syllabus, and I really like them. Omega-3 fatty acids, really basic. We are fatheads. Okay, our brains are made out of fats, and we definitely need to have omega-3 fatty acids. We tend to have more omega-6s than omega-3s in our diet. So it's important to take fish oil anywhere from 2,000 to 4,000 grams daily. And it helps to increase the neurotransmitter levels because the neurotransmitters are made in the cell wall, and the cell wall is made out of fatty acids. And eat fish several times a week, but make sure it's lower on the food chain because you've got to watch out for that mercury. Vitamins, minerals, you got to take your vitamins and minerals because those are the cofactors. Magnesium, I love it. I love magnesium. Magnesium glycinate, aspartate, glycinate. Each one has a little different angle to it. Taurate, really important for relaxation, for people who have muscle twitching, who are tense, rapid heart rates, heart arrhythmias, you name it, magnesium. Migraines. I've actually cured some people of migraines just by their taking magnesium regularly. Good for osteoporosis, essential for bone health. And it's often depleted in addicts. So dose anywhere from 200 to 400 milligrams daily, or as I say, take it to bowel tolerance. Take it till you start to feel a little gassy, a little loose stools, then you back down a little. So that's magnesium. So here are the basics, brain recovery basics: a multivitamin mineral, high-dose B vitamins, very important for the Bs, especially with alcoholics who really use up their Bs. Magnesium, vitamin C, terrific antioxidant, and especially smokers really use up their vitamin C. Take it to bowel tolerance as well. And then for cravings, chromium and glutamine, which I've mentioned. They regulate blood sugar, reduce brain fog, and cravings for sugar, alcohol, and other substances. The really big part of my armamentarium. Then for energy, tyrosine, phenylalanine. For calming, theanine, taurine, GABA, valerian, and 5-HTP. And then specifically to enhance brain cell function, and we're not going to go into these in detail, but I use them a lot in my practice. I give this to everybody who needs some brain support, which is probably 99% of who I see. Phosphatidylserine, phosphatidylcholine, acetylcarnitine, ginkgo, and of course the omega-3 fatty acids. And then what happens is that as we add in these nutrients, you start to make neurotransmitters, and the brain normalizes. And it's really wonderful to see. And this is the summary. That was the nutritional summary. This is the overall lifestyle summary. Start with a healthy diet, eliminate smoking, sugar, and caffeine. I mean, I've only said this 100 times. I'll say it 101 times. Exercise. Exercise is shown to be as good as, listen to this, as good as an antidepressant in treating depression, but you're getting a whole lot of side benefits if you're running, and you're avoiding all those side effects. So when you say they're equivalent, well, they may be equivalent in terms of their antidepressant effect, but then there's no question about which is superior. Okay, exercise is terribly important. Restorative sleep, sleep enough and sleep deeply. Add in the supplements, correct the psychological and address the psychological and spiritual aspects, and do a lot of lifestyle things, yoga, meditation, visualization, massage, dance. All of these things are vitally important for restoring the brain.